My next question would be to David. David, appending further on the thoughts that you had already shared, when you are building that blueprint for AI, how do you create it in a more sustainable and scalable manner? So the other question that any company head would have on mind is that is it just AI for one time, or is it a sustainable and scalable way of AI expansion within the company? So what would be the strategy to make sure that it is happening as a foundational change of DNA within the company, and how to access that or make it happen?
Right. Well, that's a great question. And I think that it's no different than bioethics or diversity, or frankly, before then, computers, right? Back in the 1980s, right, you decided, well, am I going to buy a computer for this administrative assistant or not? Now, you wouldn't think about adding a worker to your organization that doesn't have some digital access, right? It's the same thing with AI. It should be part and parcel of every decision that a healthcare system is making. They should be thinking, I'm now going to expand my radiology department. It's a very real thing here. And I'm adding 7 MRIs. Where am I going to find the radiologists to read the films? They're in short supply. Part of that decision making should go, what AI solutions are available to augment the efficiency of my existing group so I can expand without increasing labor costs? That is, by the way, what I think every single time I'm making every single decision now is, how do I integrate and weave this? Because that's how you make things sustainable and integral to your organization. If you do what you're going to do and then glom on top of it the idea of AI, it doesn't work. It's like coming up with a clinical program and then asking the bioethicist, well, what do you think? It's about starting a new clinical program and never once considering equity in healthcare, right? It has to be built in from the very start of every decision. So that's number one. The second thing is governance and structure around how you're implementing AI in order to make it sustainable and scalable. People have to know, how do you get an AI solution they heard about, they read about, they went to a trade show, they saw, how does it get into the system? You need a formalized, structured process. It's no different than adding a new program or a new app to Epic or anything else. You have a process where you have to look at, what's the priority? What's the labor and cost input? What's the outcome and output? What is the likelihood of success of it delivering what you're expecting it to deliver? And then prioritizing that and having a formal budget to implement those solutions as part of each project, not separate from, but integral to your programmatic expansions and investments. So I think that's critical. The governance of this has to be with people who are really smart. Because who understand what can go right and what can go wrong, and what are the issues with implementation and validity across various interfaces. And to that end, just for record, UC Davis a while ago, one of the leaders doing this, hired the White House's fellow, Dennis Chernenke, for AI. To guide us as our chief AI advisor and to create the governance structure and both implementation and post-implementation validity checks that allow us to be sure that what we're integrating into our systems will not only work, but be valid and be unbiased. And last but not least, we created a society called Valid AI. It's an acronym, but it's about 40 healthcare systems, a variety of different formal medical organizations, tech partners, and other industry partners who are committed to sharing for free. I mean, it costs a mine like $25,000 to join a year. It's nothing for a health system, but to share their use cases, their roadblocks, their obstacles. Because if you're going to scale this, you can't scale it onesie in your own organization. It'd be like trying to do an electronic medical record by yourself. You need to get the global knowledge and global group experience working together to say, this use case was proposed, it was borne out, we have that data. If you start from that point and then just double check that it's delivering those outcomes, it's a lot better than trying to recreate it from ground zero. So I think that's the other part, is doing this together, not as a single organization. I'll stop there. Thank you.